I tried this service for the first time. It's Canada-wide, and it's free for people from BC, Ontario. I think the other one is Alberta. Now, I spent more time on this than the doctor would have spent if she showed up. Okay, and this is the message I see this morning, but it was from last night. Unfortunately, your appointment is canceled. Any payment, blah, blah. Reason for cancel. Unfortunately, do not prescribe ADHD medication. And I know my medicine sometimes does get prescribed for people with that. And, I might have some attention disorders myself that it helps with, because for me it helps my focus by regulating sleep. So one of the things I did in their homework is answer a questionnaire. And it was ridiculous because sometimes like the same questions there like 3 times, just in different ways. It wasn't well done. It was easy to answer, except maybe I think that I remember the last question was maybe poorly done. But I don't think the person read it, because based on their response, I could tell it's either they read it, but they think I'm dishonest, so they write this. I don't know. Or maybe they think that medicine is only for that, and they didn't read everything. And so it's very selective. There was 3 choices of me choosing a doctor that was available the next day. Now, I already took my morning dosage, and I don't have any for the afternoon, because really I'm splitting it up. I didn't take my full daily. So I did a lot of things. I did, call in the pharmacy, make sure they had enough, or they could get enough of the prescription if I get my 3 months. So, but what's horrible here is there's no other follow-ups. It doesn't say which doctor to choose. It doesn't say anything specific. I'm not even sure if the doctor herself actually processed this refusal. I'll show you something else. As I had sent this question yesterday, dear Madam Sir, can you please provide me with a non-region specific 800 number so as to call in order to receive the semblance of virtual medical care? I do not live in any specific region of BC, and I certainly do not have a reliable GP of my own. I live in a used and incomplete camper van, and I need to renew my medicine immediately. And then this person is saying, hi there. Too bad they don't know how to read my name. You can call 811 to talk with an RN who is able to escalate to a virtual physician. How long will it take? I don't know. They put their name, so I will use it when I respond. And that is a generic provincial virtual health number, okay? Last thing I wanted to say is at this point, I'm going to record every conversation or video call that I have, because you can really tell how people's thinking is related to assumptions. They're the ones who, as the norm, show signs of attention disorders, because they always feel like they're in a rush or they're pressured for time, and they don't realize that accelerates their patterns of assumptions. But it also makes it that they're just generalizing my communication, which is normal, like it's unorthodox. It's, for example, I'm very precise in my communication because I have high level communication skills, and I can save us both time by giving the right information so that we don't jump to conclusions. And yet it doesn't work. It doesn't work with the highest levels of professionals in medical care. So that's why we got to record to show when I say I belong to a species that has more and more developmental disabilities, you can see it. And then if you kind of point that out too many times, then you're blacklisted as somebody with higher skill sets than they have. You're not hired to be the consultant of communication or to make their systems more efficient. You're just blacklisted. So it's pretty sad, but I'm going to record it now, because as a species, I know you're not letting me help in your proto-societies, but at least I'm giving you the data that you'll need if you ever decide, I don't think you will, to look at yourselves more in the mirror instead of judging others. And again, I don't think I could be a politician among politicians, because as much as they apply what they consider solutions, it amplifies the problems. They don't realize that moving money around or giving contracts, but never doing any quality assessments or oversights, you can really measure, and as a culture repair and a systems thinker, I can really measure this, that things get worse. Things get overly micromanaged. then you get more and more staff that you'll see in these recordings I'll make say, yeah, it's like this, oh, we don't like it, it's not working. And yet none of them with their developmental disabilities can actually get together and sign a letter and send it to the Minister of Health or whatever it is, saying we're going to go on strike if you don't fix this, because every time you try to apply a solution, it makes it worse. And what we do is when we hear about it from Martin, we punish him because we're frustrated with you. That's pretty much what happened.